Well, it's very common in adults and increases with age. Sleep apnea is prevalent in almost 30% of people in America between the ages of 30 and 70 years old. Tonight, a CNOS neurologist and sleep specialist talks about reading results following a sleep test and what treatments are recommended for patients.
It's a massive global type of quality of life issue to have untreated sleep apnea.
CNOS neurologist and sleep specialist Dr. James Kay says a person is more likely to have sleep apnea with increasing weight.
About 3% of people with normal weight have sleep apnea, about 20% of folks with increased weight.
The brain needs normal oxygen while you sleep. So if you have a pause or obstruction in your breathing, Dr. Kay says the brain can either choose to keep sleeping and lose oxygen or wake up.
Many times a night, the person is almost like diving up for air, waking up briefly, going back, not realizing that they're waking up. But that fragmentation is hard both on the brain and on health.
From depression to anxiety, sleep apnea can cause many long-term health complications.
From a body standpoint, having sleep apnea increases your risk of cardiovascular disease, hypertension, heart rhythm disturbance such as atrial fibrillation, and even diabetes.
Once a sleep study is complete.
This is an example of a home sleep study that Dr. He and I are looking at.
Yeah.
We have the flow being measured.
Doctors are able to indicate problem areas through the sleep data.
Where we are involved is we will read those sleep studies and communicate that result back to the doctor. But much of sleep apnea testing now can be done at the primary care level.
The dedicated team of doctors at CNOS work with providers and patients to navigate the appropriate treatment.
Treatments include lifestyle changes, breathing devices, dental appliances, and surgery, pretty much in that order. So the lifestyle changes include weight loss. If you're a smoker, quit smoking. Avoid alcohol, especially in those hours before sleep. Alcohol, people think, oh, it helps me sleep, but really it's a respiratory depressant.
Dr. Kay says as a patient, you can screen yourself at home to see if you have sleep apnea by using the Stop Bang method. You can see that method online right now at ktiv.com. In North Sioux City, Jessica Bowman, Healthbeat 4.
Now, some sleep apnea patients who qualify are trading in the breathing devices for a surgical implant. Next week on Healthbeat 4, we look at the option and who doctors say are considered to be good candidates.